Hello and welcome to Career Talk on Ogtv. On Career Talk, we are committed to giving you information on different career paths. And also, we are committed to providing this information at different levels and different industry. Today, we are focusing on career in medicine. And as always, I have with me today a guest. She is a medical doctor. She is a public health practitioner. She just bagged a master's degree in public health at the University of South Wales, UK. Make welcome, Dr. TOMI ADEBOYE.
Thank you for having me. It's a privilege being here.
Okay. So, Dr. TOMI, I'm sure a lot of people are itching to know about what it takes to be a medical doctor, to be a public health physician. So please give us a brief breakdown of your professional career,
All right,
especially academically.
All right then. So I would say, as you rightly said, I'm a medical doctor by profession, and that didn't happen overnight. It took a series of steps and a series of planning, as you've also rightly identified. So that started from coming out from the secondary school. There are a number of subjects that is required, minimum requirements of 5 credits in some subjects, maths, English, physics, chemistry, biology. Then you proceed. 3 parts that I can identify from my end. There's a route that is commonly taken at Joint Admission Matriculation Board, where you go through as JAM. You go through JAM. Then depending on the cutoff for your university, sometimes some universities take another examination that brings you in after you've gotten through the basic requirements from this secondary school, SSCE. Then you go in and get into that, depending on if you meet the cutoff mark of your institution. So that's one path. Then the path which I thought was actually, I went through advanced University of Cambridge advanced level, in which I had to go through about a year of advanced level training, and it enabled me to get into the 200 level of the College of Medicine where I studied. So that's another route into getting into the school of, we're talking about getting into the medical school that even enables you for the basic MBBS qualification that we talk about. Then after that, there's another route that is applied by some people, which is going through, you have a first degree in medical sciences that is closely related to medicine. Let's say biochemistry, psychology, physiology. Then if you have a very good result, of course, based on the university's the university's cutoff, and also based on their what they want to get and all that, you're able to go into maybe 200 level if your results really stands out and is what's based on their discretion. That's that for that. So that takes you into the med school. When you get to the med school, either from 100 level, of course, you go through a series of courses, many years of 100 level, 200 level, mostly 6 years if there are no industrial actions and strike actions in school. You're able to go through that. Then that ends you at the 600 level. In the 6th year, you're able to bag your Bachelor of Medicine, Bachelor of Surgery. But of course, you're going to still be trained for about 1 year, in which you have a provincial license, a provisional license that is given by the Medical and Dental Council of Nigeria, which enables you to train under people that are knowledgeable with you.
That's your 7th year?
Yeah, your 7th year. Okay. So in the 7th year, you're able to shadow your consultants, work with people that teach you what you need to know as a medical doctor. So it's after that now that you are now able to get your full license as a medical doctor, in which all the liabilities and the care is already entrusted in your hands. If there is any issue, it's all at your doorstep. So that's all it takes to bag the medical and the Bachelor of Medicine, Bachelor of Surgery.
Okay, so you just explained now that it could take you, it could take someone 7 good years.
Yes.
So once they have that Bachelor of Medicine and Bachelor of Surgery, as you mentioned, does that mean they have the license to treat all patients?
Okay, well, yes, they have the ability. Well, the major thing is that you can treat all patients. One of the things that come with the terrain of being a medical doctor, one of the things we're taught is to know where you end. Because when you take up a patient that you say, okay, this patient I'm taking up, you're expected to walk the patient all through. So one of the things is for you to know your bounds in terms of your clinical skills, in terms of your clinical acumen, in terms of your ability to say, oh, this is what is arising your hand skills and also your knowledge skills. So one of the things a good medical doctor knows is to know his bounds.
Okay, so a good medical doctor knows, okay,
when to refer.
Okay.
This is where it ends with me. I must roll the ball. The major thing is that you must keep the ball rolling. You must keep it, you must move it to someone else. Okay, but then there are basic skills as a medical doctor. You would not be caught. You will not be permitted to catch you without having those skills. You understand? You must be able to do things that is expected based on the 7 years, which you understand. But then it's just like me now. I'm not a surgeon, right? Oh, let me give you an example of someone that is an obstetrician who is able to, who has the hands-on skill to be able to perform a surgery like a cesarean section. Now, there's some number of complications that come in from cesarean. Everyone expects it to go on smoothly, but itches can arise. For example, the woman can start bleeding on the table, then you have to carry out a surgery called hysterectomy, in which you have to arrest the bleeding.
What is hysterectomy?
Like you have to stop bleeding is one of the measures we take for stopping bleeding in a woman that you've opened up and all that. And you find out you cannot do it, then you'll be liable for that. You understand? Because we know that a number of complications can come in from all those things, and you must have the wherewithal to be able to do that. Or if you're not able to do that, someone must be on that table that must be able to take up what you are. For example, if you're a resident doctor, you're still learning, you don't know how to do hysterectomy, but you're still in training on that. So someone is there to take up in case you have that on your hands.
Okay, so I would like to ask you, doctor, because there is a common notion about being a medical doctor. There's this notion that once you're a medical doctor, it has this job, you have this job satisfaction, you have certain job security, you know, a medical doctor, so definitely you're going to get a job, a good job, a well-paying job, you know, not paying, you have all the money, you're comfortable in life. I mean, was that what inspired you to being a medical doctor?
All right then, so that medicine makes us rich. I'm afraid not.
Okay.
But then I think that one thing I think medicine does is that it's a rather prestigious job. I mean, you have the lives of people in your hands, so people tend to.
Are you a medical doctor because of the prestige attached
No,
to
I'm trying to attend to but the job security. Okay. Well, that's I don't think so. The job security is comparative. You understand? If you compare what we have here with what we have outside the country, you know, we know where we stay. You understand? But then, as that being a reason, the prestige, not even that was enough to be my reason for being a medical doctor. I think my inspiration for being a medical doctor actually was a childhood desire, which came from trying to help people, and it was even highlighted in my childhood. In many scenarios, according to my mom, you know. And so those are the things, being able to meet people. I love to render help, you understand. That was what kept me going, when with the compassion that we have for people in this part of the world. Of course, you agree with me that there's a paucity of doctors and all that. Even from the time I trained, we didn't have. But then, so the mind to help people, to provide help, medical help for people, was one of the driving forces that made me want to become a medical doctor.
Oh wow, that's
well,
inspiring.
That riches.
Yes.
Well, if it's been rich, I'm sure I would have tendered my letter very soon, because being a doctor really doesn't make you rich.
You look rich though. I mean,
you say you look well. Medicine. The truth is that it will provide your basic needs. You won't, you know, if you're there. But then getting jobs, I'm sure a lot of my colleagues will tell you they beg to differ, because a lot of times, even despite the fact that we have paucity of doctors, the jobs are not really very available, which I also think that, of course, we all have to look at our entrepreneurial skills as doctors. I mean, don't just box ourselves into.
So doctors do business too. They're into business.
Yes.
Oh wow,
yes.
That's an interesting one. Okay, doctor, I would like to take you back. You mentioned something when I asked you a question about being a medical doctor, bagging your MBBS degree from the university. That gives you an idea to be able to attend to each patient. So the question is that there are young minds out there who wants to become a medical doctor in the future. And then, as you've rightly said, there are different areas of specializations. So could you enlighten them on the different areas of specialization in medicine?
All right then. So basically, looking at, for a medical doctor that is just coming out, of course, once you're in the system as a medical student, of course, you already have an idea of the different specialties. So it doesn't just happen at your doorstep. If you bring a medical student, even a fair idea of what you want to be comes to you while you are in the med school. You go through different departments, and you're able to say, okay, I think I really have a flair for taking care of pregnant women, or so let me just answer your question in summary. So we have different areas you can decide to be going to obstetrics and gynecology, which makes you an obstetrician and a gynecologist. Then there are also subspecialties even in obstetrics and gynecology. So medicine is a very wide field. That's on one hand. Then we also have other areas in which we have surgery. Those are surgeons. As I said again, surgery still has subspecialties in them. You can decide to be a general surgeon. You can decide to be a pediatric surgeon. But even all those fine details, a medical student that was immersed in those postings is able to understand, okay, this is where my flair is. Oh, I think I want to be a surgeon, and I think I have a flair for children, so maybe I just go for pediatric surgery, So all those things come out. Then another area, we have medicine, we have family medicine, we have different specialties, and of course where I come from, community medicine, we have that. Public health, that's another area of specialization. We have people that are even into imaging, radiologists, those that what they are looking at is they understand the physics. Maybe you came from med school, from secondary school, you really love that physics part of medicine. There are a lot of places, they're it's a large area waiting for people to explore.
Okay. So doctor, I would like us to focus more on your own area of specialization.
Okay.
You specialize in public health, right?
Yes.
Could you please give us a brief insight into public health?
Okay, so as I said, I'm an aspiring public health physician, and of course that being a medical doctor didn't enable me to become a public health physician. We all keep reading, keep updating. So in Nigeria now, what we do is that after you become a medical doctor, you've done your internship, then the mandatory NYS, depending on the case as it is, then you apply, you do what we call the primaries. You apply to the West African College of Physicians or National College of Physicians, in which you write their primaries. We call it primaries, in which that is what enables you into getting into those colleges. So I applied to the West African College of Physicians, and I took community health or public health as it is as my primaries, which was what now enabled me to go and start my residency program in public health.
So what does a public health physician do?
A public health physician, basically we are community health specialists, in which what we do is we attend to community health issues. We don't just attend to our patients as individuals. You understand? We are more upstream in our approach, in checking out what are the things in the environment, in people, attitudes, habits, and all, just to break it down, that is causing some issues in some communities, providing interventions also at the community level, sometimes in the form of policies, in terms of interventions, that's what a public health physician does.
Oh, okay.
It's like a community doctor, but you don't attend to patients on an individual, you just look at them as a community, yes, of people, and then solve their problems from that.
Okay. Doctor, there's a common notion about doctors. This is another one, because I know I've mentioned one earlier, that doctors are meant to work in a hospital. So aside the hospital, are there other places, organizations doctors can be found in?
Okay, I think I'd already highlighted that.
Yes, and then you mentioned business. So.
All right then, so I would say that yes, a lot of us, lack of being enlightened, we've already boxed the doctor to being someone that is in the box of having to attend to patients in the hospital, and remembering that not even all your patients come to the hospital. So at least in this climate, not all your patients will be able to walk to the hospital. So I would say that, well, no, the doctor doesn't necessarily have to be in the hospital. You understand? We have areas that we have still, the world is becoming a global village, We have seen doctors that are even venturing into data science. Like now, a public health physician, a researcher, checking behaviors in a community, I'm not really necessarily in the hospital, but then I'm also able to go beyond what is seen in the hospital into the underneath. Okay, so as a public health physician, there's something we call an iceberg phenomenon of diseases, in which you only see the tip of the iceberg in the hospital. The remaining, the unseen part of that iceberg lies in the community. You understand? So now we have different areas that doctors come in, not necessarily being boxed in the hospital. Then I've also mentioned to you, especially in this Nigeria of today, you can't afford to have a single stream of income. You know, so there are also people that are going into data. You know, being a doctor and being able to manipulate, I mean, not necessarily interpret data now. I'm saying involving data science into what you do, you know, bringing artificial intelligence into what you do.
Wow.
In which not, so there are still many areas to be explored by doctors in our climb.
So, Doctor, on a lighter mood and a lighter one, now, what do you enjoy most? What's that thing that keeps you going? Like, okay, I'm so tired, but I have to get to work today. What do you enjoy most about being a doctor?
Okay, I think what I enjoy most about being a doctor is I get to meet people. I get to talk to people. That part of medicine, I don't want it to be taken away from me, which you know, people say, we don't take it for granted, in which people say that there are two people you don't like to. You don't like to your lawyer and you don't like to your doctor. So no, I like that vulnerability part of people, being able to connect to people, being able to understand. Not every disease requires medicine. Some of it is mainly psychological support, in which your patient is leaving your hospital and is not living with a bag of drugs, but a weight of being removed from his shoulders. So I think that part of medicine, no one can take it from me. Talking to people, finding out why they are the way they are.
Okay, so we're still talking to Dr. TOMI ADEBOYE on Career Talk, and the career focus today is medicine. So right now, we'll be going on a quick break just to see aspiration, the young students, what they want to be in the future, and the young adults, what they're doing now. Please stay with us.
And I would like to be a medical doctor, but I'll be specialized in the pediatric part of medicine. So I would like to treat children because I really love them. I don't like to see children suffer.
I want to become a lawyer. I want to become a lawyer because I want to defend many people.
When I grow up, I would like to become an engineer. I love engineering course because I get fascinated about how inanimate objects like cars, aeroplanes and aircraft are able to move